University Technology Mara. So today's session, the theme for Exploring Medical Career Pathways, or EMCP series, as we have said, is actually the fourth of a series of 5 webinars to basically create awareness and also to update us and the audience on career pathways available for medical graduates. We are going through a whole range of established careers starting from general practice, family medicine, and we went on to surgery, to medicine, and now we are moving on today to pre and paraclinical disciplines, as well as lab-based clinical disciplines and education and medical education specialties. So we have 3 speakers with us today. And one of our speakers, Dr. Nurman, will be joining us a bit later at 11 or just after 11. So we will start first with our first 2 speakers, and I will introduce them in turn. And so our first speaker for today is Professor Dr. Norzana Abdul Ghaffar, and I'm delighted to introduce her here. She is a pioneering anatomist and a former assistant dean at UKM Medical Center and president of the Malaysian Anatomical Association. In terms of her research, she specializes in corneal cell culture. She's an award-winning educator and she offers valuable insights into career pathways in anatomy and medical sciences. I shall also introduce our second speaker today, Dr. Madiha Abdul Monir. She is a pathologist specializing in hematology, and currently she's the head of department of pathology at the Faculty of Medicine in UITM. Currently, she also serves as the head of the National Conjoint Board of the Master of Pathology program. She was also involved as a co-writing member of the National Pathology Curriculum for Hematology under the National Postgraduate Medical Curriculum. So without further ado, I think we will start with Professor Dr. Norzana. And the title of her talk today is From a Lecturer to an Educator, a Preclinical Perspective. Thank you, Prof. Norzana.
Thank you very much, Prof. Lakshmi, for the very kind introduction. Assalamualaikum and very good morning to all the attendees of the webinar series jointly organized by MAE, MHS, and also UITM. Today is a pleasure for me to share some of my experience as a lecturer in anatomy department, UKM. Actually, I've retired last October, so I thought that I do not have to give any more lecture. But the invitation came, and I think to fulfill that, and also to share my experience, I think it's okay. So that's the reason I think I agree to give the lecture from a lecturer to an educator, a preclinical perspective. So just relax, just relax, have a cup of coffee and also nasi lemak while listening to my talk. Right. What is a lecturer? A lecturer is a person who teaches at college or university. That's what it literally means. But an educator is a person who is distinguished for her or his educational work. And usually educator has various roles in academia, not only teaching and research, but also actively involved in management and administration and also leadership skill. All right. And an educator usually designs, organizes, develops, implements, and also manages educational activities in the university. And educator is highly regarded as a mentor, as a trainer, and usually the educator is usually appointed as a high and level advisory roles. And to sum up, the educator is actually an inspirational and impactful lecturer. So if any of you interested to become a lecturer in a medical school as a preclinical lecturer, or even in a clinical setting, you should aim to become an educator. Now, this is in general, the pathway of the preclinical lecturer career pathway. right, after your undergraduate degree. And this one, either you're from medically qualified or science related. You apply to the university, become the trainee lecturer, and then you have to do your postgraduate degree, master, and also PhD, and get the confirmation as a lecturer. And then via promotion, you can become senior lecturer, associate professor, and also professor. But this is the detailed pathway, right? Usually for the clinical medical graduates, usually it's MBBS, MD, MBCHB, or MBBCH. You can apply as a trainee lecturer in a university. I'm talking about public university, also in private university. But in a public university, especially in research university, you'll be given DU 51P. And the application criteria is by DU pathway. And these are the criteria. You need to have a full registration with AMMC. In order for you to get a full registration, you need to complete your housemanship. All right, you need to complete your housemanship, and also working experience of 2 years. So the three criteria is actually all interrelated. And of course, if you want to be a lecturer in anatomy department, we will expect that your during your undergraduate you have a good results in anatomy or even physiology and also biochemistry. And after that, if you apply and it's successful, you become the DU 51P. P means percubaan, a trial period. And then you have to do your postgraduate degree, master, and also PhD. Some of the university can give you a confirmation of the post after you have your master. But some of the university, especially research university, usually they want a PhD, right? And from here, you can become DU 51, you confirm and become DU 51 lecturer, and you need to fulfill this confirmation criteria. And you can apply within 3 years of your after you have graduated postgrad degree. If you got your postgrad degree, your annual performance mark must be 85%, and you have to have a good TNL. TNL has been teaching and learning. You have to have a good teaching and learning feedback. This one is the feedback given by the student and also your colleague. All right, your colleague. Usually it must be 3.5 over 5 lah, over 5. And then I think the part that's very important is, especially in a research university, you need to have publication. Now this is the recent criteria in UKM, especially. You have to get you have to publish 4 articles in WOS journals. 2 must be the first corresponding author, or the first author, and the other 2 can be co-author for you to apply for the confirmation criteria as a lecturer from DU 51P to DU 51. And then you have to have a research grant. The amount depends on the university. Research university and also non-research university will depend on the grant, but the criteria is more or less the same. And also either criteria by the given or stipulated by the university. And after the lecturer, DU 51, then by promotion, you can become associate professor and professor. And usually in research university, they have 3 tracks. Okay, you have teaching track, you have research track, and service. And usually service mainly for clinical, for lecturer in the clinical department. So for the preclinical department, the promotion criteria can choose either teaching or research. That is what we call this DU pathway if you finish your housemanship. But if in case, for whatever reason, you could not complete your housemanship, what will happen is the application criteria falls into the DS pathway. And it is actually a difficult process, I think. It's quite a long process. It means that before applying to become a lecturer in a university, you have to have your PhD. Means that you have to get your PhD ready. And to apply, you need to have 3 WS or Scopus publication. You need to present a scientific conference, and you need to have experience in research or working related field, and good CGPA during your bachelor degree of more than 3. All right. And after that, you become the lecturer DS 51. So for example, if you have done your undergrad for 5 years, but you still have to follow the DS 51 pathway, DS pathway, if you did not complete your housemanship. All right. Now, from there, the criteria for confirmation and also promotion in the preclinical department, they are the same. All right, so they have the 3 tracks and also confirmation criteria are the same. But to enter to the medical faculty as a beginner lecturer is different between DU pathway and DS pathway. Now, let's talk about the postgraduate studies. So, postgraduate study, we have master and by coursework and also full research. And also PhD. PhD mainly is full research. Master by coursework is usually full time, is 2 years, which is 4 semester. And the first year mainly is subject based, and the second year is a short project with dissertation. And you do have a master full research, which is also 2 to 3 years, 4 to 6 semester. And PhD is full research, and the duration is about 3 to 6 years. Now, this is an example of master in medical science in anatomy. In physiology, you have also, this is a coursework or mixed mode, they call it. Okay. So practically you have, basically you have to do uh, the whole anatomy, right? Gross anatomy, histology, and also embryology in the first year. Like here, this macroscopic anatomy is actually gross anatomy. Microscopic is histology, and developmental is embryology. So you have to do all system in the first semester, right? And then second semester, you do the macroscopic gross anatomy, and it's a different topic, and also neuroanatomy. If you look at the first semester, it's pretty heavy, right? And second semester actually is involved head and neck and also other system as well as neuroanatomy. You have to pass the exam in the first semester before you go to the second semester. And after you pass both semester, you can proceed to the research project in the third semester and also fourth semester. And you have to attend the research methodology class. The course outline is more or less the same for the university who offered the master in medical science, okay, by coursework. Now, teaching learning method in the first year, your coursework is actually lectures. You'll be given concept lectures and also special lectures. And you also have to attend the lectures for the first and second year while doing the master in medical science. And also you have practical gross and histology. And usually we ask the uh, um, applicant of the Master of Medical Science to become a demonstrator in gross and histology class for the first and second year. And there's also self-learning material from the e-learning portal of the university. You have to present the seminar in which that we give a topic. You need to present like you are giving lectures, and they will look at your content, look at your understanding. We ask you question and also your slide whether it's good or not. So basically to prepare to become a lecturer. And also we give it an assignment, gross anatomy, like that section based on the given topic. For example, we give brachial plexus for you to dissect, all right? Or the triangle of the neck. And histology, also slide preparation and staining method. So the assignment actually is for the continuous assessment. Now, this is the assessment for the first year coursework, in which you have seminar presentation. When you have done your dissection, we need to give a report and also photos in the report, histology report, and also you have mid-semester examination. End of semester examination comprise multiple true false question. Usually it's negative marking. You have the essay, and also you have a practical, like a viva, objective structured practical examination, or OSPE. It's like a viva with your lecturer. All right. Now, how? What is the passing mark? If you got the CGPA more than 3, which is about 65%, then you pass. Means that in the first semester of the first year, you need to get 65% of CGPA of 3. Say, for example, in the first semester of the first year, you get between 2 to 3, all right, between 2 to 3, around, like, for example, 60 marks. We give you a conditional pass, means that you can go to the second semester, but in the second semester, end of semester exam, you need to score to back up so that the average of the first and second year, you get 3, CGPA of 3. Then you can proceed to your, then you can proceed to the second year to do your research. All right. For CGPA of less than 2, this is fail and you'll be terminated from the study. Okay. So when you have finished your first year, you go to the research project and dissertation. And basically this is the activities will involve research proposal presentation. Here you'll be, you have your supervisor, you have a project, you have a supervisor, usually from the lecturer in the same department. You conduct research and then you have to write a dissertation. In order for you to pass your second year, you need to submit one manuscript to WOS, Web of Science Index Journal, and have to present in a scientific conference, at least one presentation in scientific conference, and at the end of your second year, you have to attend the viva voce. You have to defend your dissertation we have two examiners, internal and external examiner. So I've mentioned to you master by research, master by coursework, sorry, but there's also master by research, and PhD is fully research. Now, in a research university, publication is very important. You need to publish papers, it's very important. Now, to graduate, you need to submit one manuscript in a coursework or mixed mode. Means that a proof of submission is enough for you because you do a very small project, right? But in full research, to graduate, for the university to confer Master of Medical Science to you in anatomy, for example, you need to publish one manuscript, all right, accepted and publish one manuscript in a web of science journal. But in full research, you have to before graduate, you have to publish two manuscripts under WOS journal. Now, full research master can convert to full research PhD, but with a stringent criteria. All right, the requirement is in the where you have to apply early in the semester 3, right? And at that time, you should have already your one accepted paper under WOS journal, and you must be the first author, and you have presented in one presentation in scientific conference, you have completed 70% of the research objectives and completed 2 chapters in thesis writing. And you have to get a good progress report from the supervisor. And before your master can be converted to PhD, you have to add new additional objectives, okay? So that it is your project will be at the level of PhD. So you need to present your proposal at the departmental level, and after that to the assessment committee, which is at the faculty level. To present your proposal, we look at how whether your proposal is good for PhD, whether you are okay to be converted to PhD. So this is the requirement. But coursework and mixed mode, you cannot convert to PhD for research. All right. Now, like I've mentioned to you, this is the master slide. You have to know this slide if you want to join as a medical lecturer in preclinical department. Remember that in a DU pathway, you have a full registration. You have to have full register of MMC and also the requirement. But if you did not get, you will follow the DS pathway in which that you have to have a PhD before you can apply as a lecturer in a research university mainly. All right. Now, what you should do is, I will advise you as a medical student, when you graduate, you work as a research assistant while waiting for housemanship posting. Many of the lecturers hold grant. So they have allocation for research assistant. Write them in collecting the data, join them to write the paper so that you are well accustomed to research. All right, when you want to join a research university. And make sure that you complete the housemanship. I've already shown you the diagram of how the career pathway in a research university. Get a full MMC registration, and then you contact the head of department of the preclinical department that you want to join. You can contact head of department and also the dean. If you contact the dean alone, the dean will forward the email to the head of department as well. So I advise you contact the head of department by email and asking that you want to meet them. It's better for you to meet the HOD and all the lecturers in the department to establish rapport so that they know that, oh, you are, so this you, okay, this is how you are, this is you, you're good and all that. And some of the department, they hold the preliminary interview, even at departmental level. They ask you to pitch certain topics. This is like preliminary interview. So they will see you, and if you are good, they will put you in a KIV even before the job advertisement, the new lecturer post being advertised by university. So they have the name already. So when actually it has been advertisement for the new post already out, then you can have a fast track. The HOD will forward your name to the dean. All right. So you need to regularly check on the department, faculty, and university websites and social media for updates of new lecturer recruitment exercise. And before going for the main interview, I advise you to make sure all the documents are ready prior to the main interview. And of course, I wish you all the best in your interview. And that is all for my sharing. It is very basic, or all the fact is the general overview of the preclinical, especially to become a medical lecturer. And I thank you. I thank you for your wonderful attention.
Sorry. Thank you very much, Prof. Norzana. I think that was a very insightful talk, and I think with a lot of information for those of you out there in the audience who are thinking of either anatomy or any of the preclinical disciplines, as Prof. Norzana has highlighted. We will do a question and answer session at the end after our next speaker has completed. All right, so it leaves me great pleasure to introduce Dr. Maria now to give her talk on an overview of postgraduate training in pathology. Thank you, Dr. Madia. Sorry, Dr. Madia.
Oh, sorry.
Sorry,
Okay.
I think you're
Sorry.
muted. Yeah,
Yeah, yeah.
thank you.
Okay. Okay, I begin again. Okay. Assalamualaikum and good morning, everyone. So for today's webinar, I'll be going to giving you an overview of the postgraduate training in pathology. Okay, so many of you, I think, if you're a medical officer or even student, you have learned your pathology in your preclinical years. Okay, so, as you know, pathology, which comes from the Greek word pathos, meaning suffering, and logos, study, it literally translates to the study of suffering. So, when it is applied to the modern medicine, okay, it is study of the disease at structural level, which is the organ, at the cellular, including tissue and cells, and also the molecular part, the genes and protein. And with this, we provide the understanding of the manifestation and complication of the diseases. So whereby from this, we will decide on the therapy of the patient. Okay, so in Malaysia, okay, we have the field of pathology has evolved into various specialties. Okay, so following alphabetical order, we have anatomical pathology. Okay, this is the study of disease in the tissue and cell. We also have forensic pathology. This is to determine the cause and manner of death for legal purposes. Hematology, which is the study of blood disorder. We also have chemical pathology. This is the study of the biochemical basis of diseases. Medical microbiology. This is the study of disease due to infective agents. And recently, we also have two other fields, which are the medical immunology, which study the immunological basis of disease. And the last one is the medical genetics. This one, we study the genetic basis of diseases and heritable condition. So what are the training pathways in pathology? Okay, so in Malaysia, the training is almost exclusively through the Master of Pathology, or in short, we call it MPath program. So this program is currently offered by 5 training universities, which are University of Malaya, University Sains Malaysia, University Kebangsaan Malaysia, UPM, which is University Pertanian Malaysia, and my own university, UITM, University Technology Mara. And it is governed by the Ministry of Higher Education Base, which we call it is as Jawatan Kuasa Bersama Ijazah Lanjutan Perubatan Pathology. This is to ensure the uniformity of training and assessment. At this point of time, we don't have any formalized parallel pathway, such as the FRC path or FRC FRCPA. And for the training centers, it will include the public university teaching hospital and also the accredited hospital of Ministry of Health. Okay, what are the entry requirements for MPAT program? So those who wanted to pursue the program, you have to have the medical degree which is registered to the MMC, full registration with MMC. You have to have at least 3 years of clinical experience after attainment of basic medical degree. So this comprises of satisfactory completion of housemanship and post-housemanship clinical experience at least of 1 year duration. You need to have a valid APC, which is your annual practicing certificate, and in Master of Pathology, we have the entrance evaluation. So this is conducted by MPM, Majlis Perperiksa Malaysia. And after the MEDEX examination, there'll be an interview session. And for candidates, all the candidates must pass the entrance examination before he or she can be eligible for the interview for the selection into the program. So these are the mandatory requirements for the Master of Pathology program. Okay, so usually the intake for Master of Pathology is once a year, usually in June. Previously, in the COVID era, we did have our intake in December, but now we go back to the usual pattern, which was once a year in June. Okay, what are the training structure for Master of Pathology? This is a fully 4-year program, okay, structured into 2 stages, and is offered by our local university, as I mentioned before, and it is divided into 2 stages. So the stage 1 involves only the year 1. This focuses on the foundation knowledge and practical skills, and a formal part 1 examination you will have at the end of stage 1 after 1 year. And the stage 2 which comprises of the year 2, year 3, and year 4. And this focuses on the spiral acquisition of specialized knowledge and practical skills, okay? And a formal final examination you will have at the end of stage 2 that serves as the exit assessment. Okay, so now I go one by one to the stages of the program. So in stage 1 course, it is a 1-year duration of general pathology. This is our current program, which involves 4 major disciplines of pathology, including anatomic pathology, hematology, medical microbiology, and also chemical pathology, with some input from immunology, genetic, and forensic pathology. So at the end of this 1 year, the candidate will sit for an examination in general pathology, including in all the 4 major disciplines. And the candidate must pass this examination in order to proceed to stage 2 course. All right. And for the second stage, it is of a 3-year duration. And at this stage, the candidate can opt for any of the following discipline. Okay. So you either can choose if you're interested in any of these. So you now subspecialize into anatomic pathology, hematology, or the other medical microbiology, forensic, chemical pathology, immunology, and medical genetics. And during the stage 2 course, the candidate shall undertake a research project and submit a research project report. And at the end of the stage 2 course, the candidate must sit and pass an examination, which we call as part 2 examination, in order to be awarded the degree of Master of Pathology. And as I mentioned earlier, there are 5 universities involved in the running of the program. All of the university will have the 4 main disciplines, which is the anatomic pathology, hematology, medical microbiology, and chemical pathology. However, forensic pathology is only offered in UITM, okay, UKM, and also UM. And for immunology and medical genetics are only offered in USM, okay, University of Science Malaysia. Otherwise, all the other 5 universities have all the 4 main discipline of pathology. Okay, what is the duration of the program? Okay, so the maximum duration permitted to complete the course is 7 years. And for each stages, for stage 1, you are only allowed to complete it within 2 years. So if you fail your stage 1, you are given another year. And at the end of the year, you will have to resit for the part 1 exam. And if you pass, then you can proceed to stage 2. But if you fail the second attempt, okay, of the part 1 exam, then you cannot proceed further to stage 2 of the program. And as for stage 2 course, the maximum duration is permitted is for 5 years, and the maximum for the whole program is 7 years. So that is the duration of the program for Master of Pathology. Okay, and I think this is my last slide. I just want to show you the cost of the structure. This is at stage 1, as I mentioned. Okay, we have 2 semesters. And then basically there are 10-week rotation in each discipline of pathology, includes anatopath, chempath, hematology, and medical microbiology. Okay, in those 1 year, you after the 10 weeks rotation, initially when you admitted, you have orientation for 1 week. Then during the course, you have 1 intensive course and a total study of 3 weeks. Then you have your part 1 exam for 2 weeks duration. And as you proceed to each your subspecialization in year 2, year 3, and year 4, okay, you have a student-centered learning, and you also have the teacher-centered learning, and also you have the in-service training either in the lab, in the ward, in the clinic, and mortuary, either at the university hospital or at the Ministry of Health hospital. And as I mentioned, in stage 2, you have to start doing your research, and by the end of it, you have to submit, okay, before you can sit for your part 2 professional exam. So I think that's all for my slide. Thank you, Dr. Lashmi. I think I go back to you.
Thank you very much, Dr. Madia. Again, a very interesting talk, and I think with a lot of information. So I think for now we will stop for Q&A from the audience. So we really would encourage you all to you can just unmute and ask your questions directly to our speakers, Prof. Norzana and Dr. Madiha, or you can also post your questions up, I think on the chat, or I think it's the Q&A section. Do we have any questions, Amalina or Efat? So far, anything?
So far, no questions yet.
Okay.
But perhaps I can ask Dr. Madiha first before
Sure.
we get more questions. Dr. Madiha, how do one get into pathology? You have given us a very extensive guide on pathology training, but how would a junior doctor or a student even, if they want to go into pathology?
Okay, thank you, Prof. Effat, for your question. So usually for I think we have a few categories, and then for those who are in the Ministry of Health, they have to apply to their, I think, bahagian latihan. And then once they go for their bahagian latihan, okay, they like I show in the entry requirement, okay, at least they have completed 3 years of medical service and they passed their entrance examination. Okay, so when they apply, they will choose which subspecialty they wanted to do, either anatomic pathology and all the other subspecialty. And once they completed the entrance exam, the bahagian latihan from the KKM side, they will call for an interview, okay, based on their marks. And then after the interview session, depends on the availability or how much that the KKM wanted the allocation for specialists for that year. So they will ask the university and for the candidate to take the candidate. Once the interview finish and the candidate has been selected, the student will get their offer letter from the university that they choose based on their subspecialty that they have decided on. I hope that can answer your question, Prof. Irfan.
Thank you so much. Dr. Lashmi, there's some questions in the Q&A section.
Right. Okay. Thank you, Professor. Okay, so we have a question. I think that probably might be possible for both. What are some emerging trends in the field of basic sciences and medical education? And how can students prepare for these changes? Maybe Prof. Norzana, would you like to go first?
Right. Thank you for the interesting question. I think this is a very good question, right? Um, the emerging trends now is artificial intelligence. If you go anywhere in a conference and all that, they start actually presenting artificial intelligence, not just computer aided, yeah, not computer aided teaching, computer aided and all that, but now it's artificial intelligence. The challenges, okay, what are the benefits of using artificial intelligence? And of course, there's also emerging trend in terms of the research, clinical, or research, experimental research is actually precision medicine. Another one is actually precision medicine is another one. So you can actually go by this. For basic medical science, usually we use the um, experimental animal model. Experimental animal model, tissue culture before you go to the clinical. So if you want to do research, we have impactful, usually you have to have the input from the clinical as well. So in your research group, okay, you have to have clinician. So that is very big, and also the other universities. So basically what I'm saying is artificial intelligence and also precision medicine is the one that actually where people go, right?
Thank you, Prof. Norzana. Dr. Madia, would you like to add to that?
Okay, thank you for the question. I think I agree with Prof. Nozana input. So it is towards AI nowadays. And for the lab base, especially pathology, we are more going towards the molecular part. Okay, there are more now of if previously in the lab we just have only basic tests or investigation, but now we are more to now genetically we go to NGS. Okay, the sequencing part, especially those now with the current trend of treatment, when we know the genetic, we can. Sometimes we do have the you know the disease specific treatment. So molecular is important nowadays in pathology.
Thank you, Dr. Madia. We have a few questions lining up now. So the first question is also related to medical education, but we can bring that back with Dr. Nurman when he's here. The next question is posed by Sirajul. Good morning, professors and doctors. I would like to know whether for clinical subjects, can the master students choose for the research and teaching part instead of service? For example, if I want to choose a master's in, it says PSY, I'm presuming it's physiology. Is it possible to go to the research teaching pathway instead of service? Physiology or psychiatry? Thank you, Prof. Who would like to go first? This is actually clinical subjects.
Yeah.
But I think they're talking about the research teach. I'm presuming the research teaching part instead of service.
I just can give a bit of input on that matter, but since you want, if you want to choose a master in psychiatry, still you have to go to, you still have to see patients. You have to complete your master with include the ward rounds and all the history taking. And after that, like Prof. Nozana had mentioned, when you have the qualification, then usually for research or teaching pathway, you will apply in the universities for the post. So you must be excellent, completed your masters, and if you have any niche area that you can be a big point for the faculty to choose you as a teaching or a candidate for their staff in the teaching pathway. And also when you go to universities, definitely you need to do research. Yeah, that is my short input on that.
I think Sirajul, you're saying psychiatry, right? I think is what he's referring to. But Norzana, would you like to add to that?
Yes, I think you have done your clinical master, which is actually psychiatry, and then suddenly you have a twist, a change of heart. You want to do just research. All right. In a research university, you have to do research in terms of a promotion, okay? And you like it or not, you have to do research, you have to teaching as well as clinical, these three components. Yes, you can. You can actually talk to your head of department because in a research university, sometimes there are people who are very good in writing and very good in research. So sometimes you can actually talk to your head department to actually so that you can focus on the research more compared to clinical. But you cannot eliminate altogether because you're already in a clinical department. You still have to see patient, but maybe the number you can actually discuss with your head of department. All right. So possible to go to this research teaching pathway instead of service. Um, you can, but like I said, discuss with your head department. Okay.
I think I would add to what both of you have been saying. I mean, some may have a specific area, maybe in neuroscience, if you're looking at psychiatry, and then therefore the research aspect could be more basic science, it could be more lab-based, but then probably, if you already have that clinical background, it would be a shame not to make use of the clinical aspect, service aspect as well. You could do, from pharmacotherapeutics to anything related to, as I said, with your patients as well. So you can be an academic as well at the same time have you can work in clinical research as well. So that is always there. But I think, as both have said, you need to perhaps check with the your supervisors, your head, and so on. I think. Moving on to the next question from Akmal Haron. He has two questions. So first question, with the masters and PhD, may I know where else I can work other than the university? And the second question is, what are other career progression options other than academia or university? Okay, that I think, are you referring to masters and PhD, Akma? You can put a yes or no for the second question. Maybe in the meantime, we can, oh, yes, okay. So he's referring to masters and PhD. Maybe Dr. Madia, would you like to start first on this one? With the masters and PhD, may I know where else I can work other than university?
Okay, thank you for the question, Akmal. So with my limited experience, so for MPhil, we actually for PhD, there's another pathway which we call is Master of Science in for that. But for pathology, so we are basically doctors and we are running the lab. So we are now currently have only Masters of Pathology. So so our main candidates are mainly from the Ministry of Health. So basically, they will go back and work there. But some others of you are also from the universities. Beside from that, I don't see any other pathway. But there are some that do goes to private labs, okay, private hospital. They do work in private hospital, and some even do work in private labs as the lab directors with the background of pathology. Because as you know, there are private labs that where the GPs send, like Gribbles, Innoquest, so that there are lecturers or from the ministry itself, or even the university that after they didn't work in the university, they do go to that pathway. Yeah.
Nozana?
Right. Actually, you can work in the research institute. There are many research institute here because with master and also if you are from medical background, you have a master, you have PhD, you are very good. So you can work in research university. If you don't want to work in a clinical, don't want to become a lecturer, you can become a fellow researcher in institute. Either it's government or a private. Okay, that's one. The other one, you can go to the government link company. Okay, government link company or other companies or sales, become a sales representative, and also as well as selling equipments, reagents, and all that. I've seen students, especially those in a PhD in biochemistry. Okay, they are very good. Okay, they elected by the companies to become the person, and they. I mean, I think my friend who's actually doing the same PhD, the time same as me, already high post. So going into research. Okay, it doesn't matter. I mean, it's open to you. And the most important is another one is drug company lah, because you know the basic sciences. You can also be, because once you pass your PhD, you're a very good orator already. You can actually speak. You can actually sell things better than other people. All right. So it's not actually stopped at the uh, medical school only. Okay.
Yeah. If I can add to both of what you all are saying, Akmal. So we also know now in schools, all right, there are PhD holders coming back to schools, to secondary school, to pre-U, to teach. All right, so that's one area you're right. Really want to shift away from. You're saying other than academia and university, some of the good schools, top schools now, international schools even are taking on PhD candidates. Okay, that's one thing. Definitely, I think there are PhD candidates who have gone on into private labs, pharmacotherapeutics. All right, you can work with clinical trials. Right, there's so many areas that you can actually specialize in. We've also had some candidates who then went on to do an MBA and then moved into the business sector related to biomedical sciences or clinical sciences, medical devices. I think that's also been mentioned, and
Yes.
so on. Right. So there's a lot of areas that people can actually move into. I think for the last of our webinar series in January, I think it's on the 13th of January, one of the speakers actually is a doctor who has a pharma background and then went into hospital admin. All right. So these are things perhaps that you can perhaps look at on a broader level. All right. Career progression, does that, the second question, what are other career progression options other than academia and university? Maybe has your question been answered, Akmal?
I think it has been answered.
Has probably been
Okay.
answered, I think. Yeah. Are there any other questions? I don't know whether we still have a few more minutes before Dr. Nurman, unless he's already here. Any other questions from the audience? Perhaps I have a question. I think maybe, looking back at the other webinars we had sometimes very candid responses from our speakers about how do you maintain a work-life balance, right? So being, I think it was internal medicine or being a surgeon. So in this case, by being a pathologist or being a preclinical educator, anatomist, how did maybe each of you, are there any tips you want to share for would-be preclinical, educators or would-be pathologists about work-life balance? Perhaps, Norzana, would you like to start?
All right. Actually, I joined anatomy department as a medical because I want to be a medical lecturer in anatomy, not because of the family, not because I want to stay in KL. No, it's because of since my student day, I want to be a lecturer in anatomy after I finished my medical school. In fact, when I was in UK, I told the JPA whether I can actually, because I was scholar, JPA scholar, I asked whether I can actually proceed to do bachelor to do what do you call it, honor degree in anatomy, but I can't. So I have that interest very early on, so that I know what I want to do at that very moment. So I do something that I'm very passionate of. Okay, I like it. That's why. So I think it's really teaching anatomy, reading anatomy, looking at the structures. I feel that it's really very happy for me. It's like work-life balance for me, apart from going shopping, apart from gardening and all that, okay, with the family. So it's actually working in anatomy it's a very happy environment for me. So because I like it. All right.
Thank you, Norzana. How about you, Madia? Any tips?
Any tips? I think uh, how do I say? Currently, I'm the head of department, which is it's a bit different life. I think from Azana have been through that. It's a bit different from the lecture, but you do need to balance between the life, the work, and your life at home and your work. And I think with the help of your friends and you do need some guidance from the seniors, then you should be able to maintain the balance. I think you should not concentrate too much on the work will be on and on, but you have to know how to prioritize and manage your work, and so that it will balance with your family, so your family will not be left out or left behind. Yeah, so that is my tip.
Thank you very much, Dr. Madia. We have one more question. I think we are waiting for Dr. Nurman to join us at about 11. So we have a question from Ash. How has technology such as virtual anatomy software or 3D modeling impacted the way anatomy is taught and understood in recent years? So maybe, though anatomy and pathology are quite closely related, maybe I can ask Prof. Nozana first on this.
Right, this is my subject. All right, anatomy. Yes, yes. I think in recent years, the teaching of anatomy has changed from dissection, seeing cadavers to become computer aided and also virtual anatomy software. But again, I think there's an article in the UK saying that for virtual anatomy software and 3D modeling, uh, is probably okay for the undergraduate, but postgraduate you need to have the you need to have the bodies, the cadavers and all that. That's why, okay, so the undergraduate, some of the university do not have cadavers at all, but having a cadavers actually in the UKM, the pastinated specimens and all that is actually is actually is really really good in understanding the anatomy, because looking at the structure. If you look at if you look at the computer, look at the heart. Okay, it's just 2D. You do not know the 3D or even 3D model is not the same. The texture will not be the same. So being the anatomist, I have the old thoughts. It's good to have the kind of the virtual anatomy software and 3D modeling for me is an adjunct. It's actually addition. If you have that, I mean, it is really very good. It will improve your understanding. But in undergraduate, for postgraduate, you need to have that, right? That's why we have master part one course, intensive course that actually that have hands-on practical by using the cadavers. Okay, thank you, Lakshmi.
Thank you, Norzana. Yeah. So just to highlight, so apart from UKM, a few of the public universities here do run masters in anatomy or masters in physiology or biochemistry programs, right? So, most of them will have, as you said, a dissection element, right, in the master's program. Dr. Madia, would you like to add to that?
Yeah, okay. For the virtual, I think you can see a lot in difference in pathology, especially during the COVID area, that some students are not allowed to come to the faculty, but we still need to teach pathology. Initially, we do show slides, okay, for those who are medical students, used to see slides, but now with the era of COVID, we are now moving towards the virtual, but still, usually the one which deals a lot with the tissue are the anatomic pathologists. Usually they will get it after surgery, so it's still the tissue. Then from there, they process the tissue and diagnose the tissue using the microscope. But it is an aid actually with this virtual, because with this we can do conferencing with other for second opinion or discuss case. We can use that one, we scan, we save the slide. We can do it to teach students for those rare cases, which we can use for the future. And also, I think even now in the lab, we also in those who are having accreditation with ISO 15189 for the EQA, okay, external quality assurance. In my case, in our lab in hematology, so now they didn't since we subscribe to ICP, they don't send slide anymore. They just give link to virtual slide, which still can be used for the quality assurance program. So it is actually an adjunct in our lab and our teaching in pathology. Yeah.
I think that's an excellent point, right? So nowadays in pathology, a lot of our public institutions, hospitals, and also private hospitals, right, government and private, more and more utilizing digital slides. So not only does that make it easier to access, maybe also with like CPCs and consultations, right, and discussion, it's actually then provided that ease. So not only can you discuss maybe a complex pathology problem nationally, you can even bring in international experts, right? And so on. Yeah. Okay, so I think at the moment we have no further questions, but I think we are still, I think, waiting for Dr. Norman, who will join us soon. Are there any other questions from anyone?
Lakshmi, may I ask a
Sure,
question?
sure,
Dr.
go ahead.
Madi, yeah, can you tell us a little bit about the national curriculum for pathology training, and is there any alternative pathway other than the MPath program? Thank you.
Okay, thank you, Prof. Fad. Okay, as some might be not aware of, initially we have the NPMC, which is the National Postgraduate Curriculum Review. So one of them involved is the pathology. So at this point of time, we are still waiting for the curriculum to be endorsed by Senate of each university. And at this point of time, we are still using the previous curriculum. Until we have endorsed, then we will announce when we will use the new curriculum. And the second question, Professor, just now, sorry, I didn't catch it.
Yeah, other pathways for you to train as pathologist if you cannot get into the MPath program.
MPath program. So for, I think for anatomy, I think we have the RC path and prof effort that is from the Austria part, which is if you, that one can be a pathway, but it is not yet it's not yet, I think, formalized, but there are some candidates who came from that pathway, and I think they can come and it is I think it is recognized here in Malaysia. I think this is mainly for anatomic pathology, and there are, we do have some for hematology as well, but I'm not quite sure of with the other disciplines such as microbiology, ChemPath, or yeah, the other two I'm not so quite sure of.
Thank you very
Thank you.
much, Dr. Madhya. Sorry, Afan, does that answer your question?
Yes, yes, thank you.
Yeah, I think we had some of this discussion in the earlier webinar series as well, where some of the parallel pathways are still being formalized and under discussion. So I think with maybe a general piece of advice to anyone looking at postgraduate education and training is to make sure that you're updated, look at the latest resources, and I think go back to, you know, the institutions or centers for I think the final say. I think just to make sure that if you do take up a particular program or course, that it is recognized and you're able to practice and so on. Yeah, I think we have Dr. Norman here now with us. Hi, Dr. Norman. Welcome.
Hi, good morning. Sorry
We've
for
been
the delay.
No, it's okay. We've been having a lively question and answer session. So maybe I could have the pleasure of introducing you as the next speaker. So Dr. Nurman Yaman is a senior lecturer at University Kebangsaan, Malaysia, and he specializes in medical education. He's an alumnus of the University of Sheffield, and he advises on medical curricula and quality assurance, in particular accreditation that we're all familiar with, and we see him very often. So, and he's able to provide key insights for aspiring medical professionals. So today, so it leaves me, without any further ado, for Dr. Norman to talk about life as a medical educationist. Thank you, Dr. Norman.
Okay, thank you very much to Prof. Lakshmi for a kind introduction. Assalamualaikum and a very good morning to all. Really sorry for a bit delay during this session. For information, I'm currently in Unimas Kuching conducting a major curriculum review workshop. So let me share my screen. So the topic that given to me is basically about medical education. So can you see my screen?
Yes.
Okay, all right. So the topic given to me is basically about medical education. This basically is a career pathway to anyone interested in medical education. So I just give, I would say, a brief run through of Basically, you want to be a medical educationist? I hope so. So this is my presentation. First of all, I just want to make a disclaimer that the content of this presentation and the presentation are solely of mine, not of MEC, MMC, as well as UKM of my aims. As what Prof. Lakshmi said, that I am quite highly involved in MMC. So what I say is solely of mine, not MMC. So the topic and the content that I'll talk about is basically the one husband and five wives, the why, the what, the who, the when, the where, and how, and lastly about reality. I think the poster stated about my life, but I will share a bit of reality of being a medical educationist. I would say specifically in Malaysia. So let's start with the first one. Why do we need why is medical education is very important? Nowadays there are a lot of I would say clinical programs, undergraduate programs, a lot of health-related programs. So that's where, if in the UK, if I'm not mistaken, in 2005 or 6, they have started an academic medicine pathway, as similar as the other specialist pathway. So they need someone that are quite well versed in the education of the medical health side to try to manage basically everything, how they run, how to run the whole academic program of medical and health science or healthcare related, and also involve because there are academic programs. Obviously, there are undergraduate program as well as postgraduate program. I think all this while in Malaysia, we are really, we focus more on the undergraduate, but starting this year, MSc have produced a standard on the postgraduate clinical program. So hence, there is even more important why the medical education must be around. It also involves teaching and learning strategies. Who will teach our colleagues in terms of teaching and learning strategies? Previously, it tended to be apprenticeship, but as we go along, the number of students increases. It's quite difficult to have a one-to-one mentoring for the whole 5 years. Hence, we need to have some sort of strategies in order to teach and to students as well as for students to learn. And when they are teaching and learning, obviously there are assessment strategies. And obviously, due to big numbers, we are unable to assess them individually, but there are ways of how to do this assessment. Apart from the student side, we also why medical education is important is because we need to prep our colleagues in terms of the above, the teaching and learning and assessment strategies. Who will teach this? Who will teach them? So that's the reason why medical education is needed. And when we have a faculty development as well, that's one thing. But when we have a faculty, sometimes it's a new medical school or a new unit or a new department, they need to have new curriculum. So who will develop the curriculum? It has to be based on something, based on the standard, based on the program standard, based on the curriculum something. And then once you have done it and you run it for a certain number of years, then you have to do a CQI, the review. Then who will do it? Okay. So that's where involve the quality assurance in terms of CQI and accreditation. That is why medical education is important. So what is medical education? And that's the why. We've done the why and what. Sometimes, like for me, okay, when I was given this topic in terms of medical education, I have to ask the organizer, what do you mean by medication? Do you mean the undergraduate program or the postgraduate program or medical education as a medical education? So they told me that it's a career in medical education. So please don't mix up with whenever people talk about medical education. Sometimes if we are a bit if you are a bit confused about what they explain, just to make sure that is it the medical education as medical education or the medical undergraduate education or the medical postgraduate education. So that one you really have to be aware of. And now since 2020, NEC code stated that medical education is a specialty under code 0912. Actually, medical education is a broad and far-reaching field with the main aim to, because we have to train, and apart from train, we have to inspire and motivate not only our medical students but also our lecturers. Why I said medical students is because the curriculum, if you remember, why is medical education is very important, because we are involved in curriculum making. And when we do a sample curriculum, it has to be able to inspire and motivate our medical students to learn medicine. And obviously the same thing goes to our doctors or lecturers, because if we want to run the curriculum, obviously we really need to find a way of how to help, assist and motivate our lecturers. And for me, medical education is great for a career flexibility. And now is no longer involved in undergraduate, but also in postgraduate levels. What is the content of medical education? This is the usually the basic in Malaysia, but I believe there are a lot more. So if anybody want to be a medical educationist, need to know about teaching, learning, methodology, and advancement. And because of COVID, there are extensive use of digital education and simulation. So we have to get to know about this. And when we have a teaching learning, obviously we need to assess. So assessment strategies always must be done by medical education. It's the same, it's basically a repetition of the previous slides, but this is what are the content, program evaluation. Program evaluation is separated from accreditation because sometimes program evaluation happens at the end of the program, at the end of the course. It depends on the institution whether they want to evaluate the effectiveness of the course. Usually they will ask medical education some assistant how to develop evaluation instruments. Okay. Next is the program accreditation. I think all of us are really on our toes for these few years and coming years, especially for postgraduate, where MMC are doing accreditation process. So having a medical education personnel in the faculty will definitely can assist how can we answer or fulfill the accreditation and how we comply with all the standards. Apart from the above, we also can be involved, as I say, can be involved in PPD or PPA, personal and professional development. Like for me in UKM, this PPD or PPA is part under my department. So we are also involved in creating this personal. There are some institutions they separated this from medical education. For example, if I'm mistaken, this UITM they have a separate medical ethics and jurisprudence department, something like that to handle this. Obviously, if you're a lecturer or even a medical educationist, research as well as SOTA scholarship or teaching learning is one of the major things that we have to do. We have to share our knowledge or our practice to our colleagues around the world for our best practice. And lastly, this is I think this is my personal is student selection. Tendency of medical education, tendency of the faculty, usually the faculty office or the academic office will ask assistant from medical education how best we can select our students, whether is it through some cognitive assessment, some psychomotor assessment or psychometric assessment or aptitude assessment. That one usually they will ask medical educationists. So next is who is a medical educationist. It can be someone with medical and health sciences background. Basically, it's quite general. That's the reason why there is a flexibility for medical education. Either you come from medical, dental, pharmacy, nursing, and health. Everyone can be a medical educationist. And this medical educationist must be interested in academic side of medicine and health sciences. And if you want to if you want to be a medical educationist, I would say ideally to have some sort of qualification. And so far at the moment, what we have in Malaysia, they are certificate in medical education, or also known as health professions education, HPE. Either you do certificate, diploma, master, or PhD. Generally, medical educationists are mainly in academia, in educational institution. There are some from outside, but they are originally from the academia. So these are the who is the medical educationist. Next is basically is where to get this qualification. I would say ideally, this one is not ruling whether you must do this first, do that later. No, but ideally, usually is after your first degree, either your first medical, dental, pharmacy, nursing, and health. So it becomes a postgraduate qualification. Two ways of you want to be a medical nutritionist. One, to be a pure medical nutritionist. Like myself, I have a degree in medicine, I have a master in medical education and a PhD in medication. That will make me as a pure medical educationist. But there are also our colleagues who are medical educationists by qualification, where they've done their specialty first. For example, I think the one that I've noted the series, let's say, for example, Dato' Yang. Dato' Yang is a radiologist in UM. She has a master in medical education. So she's considered as a medical educationist by qualification. That's an example. Okay. And it is at any age. I'm not young, but it doesn't mean that if you are retired, you cannot be a medical educationist. You still can be. So at any age, you can be a medical educationist. Don't worry that, oh, I have to be medical educationist at the very early stage of my life. No, I think it depends on you. We don't set that just like other clinical, you must be below 40, you must be below 45 to start your master. No, I think we are quite open in that area. Ideally for us, if you are a medical background or dental background or pharmacy background, we would like you to have some years in service. That's why I put as ideally after medical officers. Yes. The reason why, this is my personal opinion. The reason why I said ideally after MO years is because when we become housemen, we tend to follow orders. At the end of the letter, saya menurut perintah. So as housemen, basically we receive orders from our seniors. We hardly give orders. But when you are graduated from housemanship to medical officers, then you start, saya memberi perintah. You start to give orders to your housemen. The reason why I said that is because in order for you to be a medical educationist, they're able to communicate with all levels. Because, so for example, if you're at the HO, how do you communicate with your seniors? And same goes to medical officer and so on and so forth. So being a medical officer means that you have one, ability to follow orders, second, ability to give orders. So being a medical educationist, unfortunately, you need to advise sometimes our seniors what are the best way in terms of medical education. That's the reason why I put ideally after medical officers. Yes. Okay. Where? Okay. Medical education programs, they can be in coursework mode, mixed mode, research mode. Coursework, I think it's on the, in public will be in UKM. Mixed mode will be in USM, if not mistaken. Research mode, if not mistaken, in faculty USFIM, but usually it's under the medical science strand. I think UM is research mode, if I'm not mistaken. There are also medical education program in private university. One example is in IMU, where they have cert diploma and master, and as well as soon to be PhD in health professions education. Apart from local, don't worry, there are also overseas top program. If you have the time and basically the time and the financial to do it over there, you can do it. This is example. There are some more other institutions that can provide medical education program, top program, either in Dundee or in Maastricht. And also there are also online programs. Currently, I'm doing curriculum review in Unimas, and I did manage to talk to some of the clinicians, some of the lecturers, that there are always a ways if you want to improve yourself in terms of migration, is to take some sort of online program. For example, ESME, Essential Skills in Medical Education by ME, and also there are some institutions provide ODL program. I think the Dundee also is doing an ODL program. So there are ways of doing extra qualification in medical education. So just to give one example, as I am from UKM, definitely I will promote my institution. So this is the website of my department. So I'll talk about a bit of generally the Master in Medical Education coursework by our department. It's a full-time 3 semesters. Some institutions do 2 years, some institutions do 1 year, some institutions do 1.5 years, and for us, for full-time, is 1.5 years. You also can do a part-time. When we divide this into 3 semesters, these are the topics that we focus on. For semester 1, basically are the introduction part, where the trends and issues in curriculum planning development, introduction to instructional design, the basic principle of student assessment, the basic teaching learning methods, as well as academic writing 1. And usually it's by assignments. When it comes to semester 2, now we are more advanced in terms of teaching, learning, assessment, everything. So that's why we go for problem-based learning, clinical teaching, assessment in terms of performance, and now we involve research and as well as CAT, computer-aided teaching and learning. It's an advanced teaching and learning methodologies. And for semester 3, we are concentrating more on the research part by doing dissertation and also research methodology class 2. So that's how you can be a medical. Okay, we've done all the how, the why, the what, the who, the when. Now is the reality. It's quite difficult for me actually to come out with the reality. Okay, but this is the fact where all we have to be involved in service, either to faculty, usually or even to the nation. But for example, MMC, you are also involved in teaching, either in generic courses, your own discipline, and also you have to facilitate everything in the teaching domain. Administration also you have to be involved because you are involved in undergraduate and postgraduate. And lastly, research is a must if you are a lecturer, whether you need to get grants, sort of, or projects, whether it's at national or university level. And for myself, based on service, I've given a service to my department, my faculty, some healthcare faculties in UKM, dental, pharmacy, some other locals, and also obviously medical schools. I'm also involved, as what Prof. Nasmi has said, in MMC and accreditation panel. I'm both in undergraduate and postgraduate panel, as well as a curriculum review committee. In terms of teaching, I'm involved in our PPD, PPA, facilitators for PBL, CSL, as well as our postgraduate program and administration. These are the days, basically, the things that are not attached to any discipline, usually it goes to the medical education. So module heads, advisor, student selection and fusion program, and research is a must for everybody. And this is what I have involved. Thank you to my colleagues, everything, for inviting me to join in the ministry project as well as Dean Council's project. So that's roughly a nutshell about my journey in terms of service, teaching, administration, and research, which is STAR star. So I think that's all from me. Back to you, Prof. Tashmi.
Thanks very much, Dr. Nurman, for that most insightful talk. And I think you have really given a lot of detail and information about entry requirements, what is medical education about. As Dr. Nurman has mentioned, you could be full-time into it, right, with the required qualifications, or you could be a clinical specialist who has an interest in medical education, as with Prof. Yang Farida, who has then become later in her journey career become a medical educationist, right? So there are many ways in which we can approach this important topic and discipline. All right, we do have a question, and please, others in the audience, please do just unmute or post it up in the question and answer chat. So the question we have is, just now you mentioned that medical education provides career flexibility. Can you elaborate further on that? Thanks, Dr. Nurman.
Okay, thank you for the question. In terms of career flexibility, means that, let's say, for example, if early in your medical career, you have yet to, you have interest in hospital medicine first. You haven't seen the whole picture of the medical education. So this the facility means that you can do your clinical specialty first. Then after you've done your clinical years, maybe you want few more years of service. Then when come the postgraduate education, postgraduate accreditation, and everyone need to know about Area 1 curriculum, assessment, student selection, so on and so forth, then you start to say, why don't I learn something from medical education? There's the avenue for you. You can learn whether you want to go directly to the top program or even a open distance learning program or PJJ. So that's the flexibility that what I mean. We also have, like for example, in our department, we have our students who are already a biochemistry lecturer who have done their master PhD in biochemistry, and she decided to do master in medical education. And currently, she's the assistant dean for teaching and learning for the faculty. So by having that medical education, really helped her in running her post as the assistant dean. So same goes to like all our colleagues. They do have some sort of master's degree. So for me personally, I will not pull them into medical education department. I will let them be in their respective discipline because they will try guide their own colleagues. For example, Dr. Jalina is a nursing who has a PhD in medical education, and because she's in UCAM, I didn't request from the dean to take her to medical education, but we let her to be in the nursing department so that anytime they want to do some discussion, they don't need to invite medical education every time. They already have a medical representative in the department, so they can just refer direct to her. Same goes to, let's say, in the radiology department, they need some ideas, small ideas about medical education, they can just contact, for example, Dr. Young, rather than go through the medical MU or the process and everything. So that's the flexibility that I mean that you can start early, it's up to you, or middle stage, or even some do take it when they're retired. I think it's time for me just to focus it on the teaching, but I would like to teach effectively. So maybe meditation is a better, I would say, module or program for me in order for me to achieve a better lecturer when I retire. That's the flexibility that what I mean. Thank you.
Yeah, I think well said, Nurman. I think so. I'm from Monash University, Malaysia. So we have a graduate certificate in higher education, and as you rightly pointed out, we have retired surgeons and so on who decided they wanted to go into teaching, whether anatomy or anything else, clinical skills. So then some of them have taken on a grad cert in higher education. All right. So the next question from Sirajun. Good morning, doctor. After pursuing medical education, is it possible to involve and work as a medical educationist in courses which are not solely medicine or dentistry, but other courses like pharmacy, biomedicine, etc.?
Okay, for that, it depends. I would say it depends on individual. How far you want to go. Like myself, I do. People from pharmacy and also dental do seek advice from me. Nursing do seek advice from me. MA as well as nursing, radiotherapy, everything. All the minor posting under KKM have consulted me. But whenever you are being consulted, you must know your territory. Okay. What I mean your territory is basically every teaching program, there are always teaching and learning strategies, assessment strategies. Okay. All these TLA, teaching, learning, and assessment strategies, it has to be validated and with high reliability. And that's where we come from. But how to do it, what is the content, we have to rely on the content expert. So let's say for nursing, they want to do this, let's say they want to do long case. So obviously one long case is low validity. So the best way is to increase number of long case. That's where we come in as medical educationists. But in terms of how to do it, what are the case selection, we will work together with that discipline. We never say you must do this. For example, currently I'm doing curriculum review for undergraduate UNIMAS. There are 10 modules, there are a lot of specialties. When it comes to, for example, the most common thing that people will ask is table 4, right, Lashmi? Table 4 is a must for accreditation. Without table 4, you will get your area of consent. So how to do table 4? I just cannot say, oh, you must do this is how much you must do. No. That is not what the role of medical education is. More basically to guide them. So what are the topics that you have? Then we rely on the core competency. So how do you teach and how to manage? We just give advice to them. The main thing is they try to follow what we call, one is best practice, one is the standard that we already released for our local programs. So we cannot work just as a person to instruct. We tend to collaborate and work together to find the best way in order to get the best out of our students at the end of the program. So that's how, even though biomedical or pharmacy, and I even went to Faculty of Economy in UKM to give some advice on how to select student. So at the end of the day, I just say, what character you want to want? Oh, this character. Okay, why don't we give some ideas for them so that they can think about it. I think the last, I think I went to Bandung, if I'm mistaken, we can share. It's a marine program, and they said, how can we MMI for marine program? I just said, does it involve scuba diving? Yes. So they can be your question can be based from scuba diving, setting up the equipment, and what are
Nurman, you
the
may have
issues
to
in scuba
explain
diving.
MMI to maybe some of the audience
Okay,
may not know
MMI is
what's
multiple. MMI is multiple mini interviews where we do some sort of student selection in order to find the best student that fulfill all the themes that we have set. So for marine, so for example, that marine is involved, let's say cognitive. So if you want to test the cognitive, if you don't want to use the paper based, you can use the interview based, basically the equipment. And if you want to do a psychomotor, which is doing it, you just put the equipment on the floor and ask them to assemble. So it's a lot of ways. So we just give them how can it be done, but the content and the marking scheme, everything, it must come from the content expert. Okay, I think that's explained. Yeah.
excellent. We had we had a question in the beginning when Prof. Nozana and Dr. Madia were doing the Q&A, which they also included something on medical education. So we thought we will ask you that. So the question was in relation to, they were talking about, I think, the research component and emerging trends in the fields of basic sciences and medical education. What are some of these emerging trends and how can students prepare for these changes?
Okay. I said the good line. The good thing about COVID is they push us to a limit that we never encountered before. Never in our life in medical or even in healthcare that we do online teaching. But if we want to change back to the old system, everything face to face, nothing, we won't be here live. This online is what we learned from COVID. We never know that there are Zoom, WebEx, and everything. So this emerging, the role of, this, I would say, you can do anything to it. You want to research the effectiveness, you want to explore further. Even for this webinar, there are a lot more ways of doing it. Some have gone beyond the webinar, even the AR, VR, territory simulation combined together, everything. So it's everything is what in the mind that will limit us. So if you want to go further, obviously, to tell you the truth, medical education cannot work in silo. We have to work with other people's. Like Prof. Lashmi you're in preclinical side. There are things that you want to expand. You might need some help from us, and maybe we have some ideas. We have to work together. That's the only way. There's no way that you can work on. I'm a medical student. I want to study online simulation for clinician because there is an idea during COVID doing a clinical examination online. So we have prepared, at that time, my idea was a three Zoom camera where one camera is by examiner, two examiners, and one by a faculty to make sure everything is run well. A three camera clinical assessment, but the idea never take off because of the cost. So these are the ideas. Maybe in the future, I'm not asking for the COVID, but there is a still possibilities that you still can explore more things beyond that. So I think that's the only thing I can answer for that question.
Okay, thank you very much, Dr. Numan. Are there any other further questions? I think Amalia or Efat, I think If there are no further questions, I think it just leaves me to thank our panel today. I think we've had an excellent discussion, and I think in an area which we don't always talk about in career terms of career pathways, especially to a wider audience of medical students, house officers, medical officers, and even for us academics and so on. All right, so it really gives me greatest pleasure to thank Prof. Norzana, Dr. Maria, and Dr. Nurman for your time today and for your participation, and to the audience as well. I'd like to give a special thanks to UITM, all the people behind the screen we can't see, who have been so instrumental in setting all this up for us and helping in the organization, together with my task force members, Prof. Zulaiha and also Dr. Salami. All right, so I'd like to thank everyone. Please, maybe just an announcement. So the fifth and last of the webinar series, there were a lot of questions that came up in terms of other careers as well, will be on the 13th of January, again a Saturday, again 10 o'clock, and we'll be talking about alternative career pathways in medicine. All right, so do join us. I think we have someone from pharma, hospital admin, also from business and corporate side, and possibly also from in one of the NGOs. All right, so thank you very much, everyone. Thank you.
Thank you. Have a nice weekend, everyone.
Yes,
Yes,
good weekend,
Assalamualaikum.
everyone.